Welcome back to No More Cavities. Today we are discussing a new chapter, that is caries. So first we will discuss what is caries and how it develops. So caries is a process by which dissolution of our organic and inorganic matrix occur. So consider you have taken a carbohydrate in your diet and it will fermented by your body, converting into acids. Carbohydrate is fermented into acids by the help of microorganisms. Microorganisms will ferment them into acids, and as we all know that if acids are present, they will decrease the pH. The decrease in pH, if it present for a greater number of time, then the result will enamel dissolution. Now what happens if carbohydrates are not available to microorganism? If carbohydrates are not available to microorganism, then they will not be fermented into acids. If they are not fermented into acids, the pH will obviously increase. So if the pH increases, then the question arises how? Actually, the pH increases by outward diffusion of acids. Outward diffusion of acids and metabolism of acids. So if there are no carbohydrate present in your diet, then it will result in increase of pH. How? It will cause outward diffusion of acids and metabolism of acids. If this occur, it will neutralize our pH. It will neutralize our pH and indirectly remineralization occur. That enamel that was dissolved, it will remineralize. So when the demineralization or remineralization occur, usually there is balance between demineralization and remineralization. There is a balance, normally there is a balance between remineralization and demineralization. If this balance disturb, if demineralization start occurring, then caries will occur. So this all was known as chemoparasitic theory. Chemoparasitic theory, which is nowadays known as acidogenic theory. That means that microorganisms present in our body convert the carbohydrates into organic acids, resulting in decrease in pH, and this decrease in pH will result in enamel dissolution. But what occurs if carbohydrates are not present? It will increase in pH by outward diffusion of acids and their metabolism, resulting in neutralization of pH, and remineralization will occur. There is a term known as erosion. What is erosion? Erosion is the loss of tooth substance. It is loss of tooth substance occurring due to chemical acids. So here we discuss that caries is also occurring due to acidic environment. But there is a quite difference between erosion and caries. And what is that? Erosion is a surface phenomenon, but caries is a subsurface phenomena. Now what is the difference between surface and subsurface phenomena? Subsurface phenomena means that the mineral lost beneath the intact surface. For example, consider this is a tooth. Now there are layers. For example, this is an intact tooth surface. We see that there is no surface loss, but inside it there is a surface loss. So caries is a subsurface phenomena, as erosion is a surface phenomena. It is visible to you by naked eyes, but subsurface phenomena is not visible to you to naked eyes until and unless it occurs very grossly. So this is the difference between erosion and caries. Erosion is not a subsurface phenomenon. It occurs at much less pH than 4. Erosion occurs when the pH is less than 4, but caries occur when the pH is less than 5.5. So this is difference between erosion and caries. Now caries occur on those parts of the tooth where plaque is accumulated. What is a plaque? Plaque is a biofilm. Biofilm of what? Biofilm of microorganisms. Microorganism. In plaque, 100 million per milligram of plaque. 100 million per milligram of plaque microorganisms are present in a plaque. Now, when the plaque contains different type of microorganism, when the plaque is young, when the plaque is black is young, it contains cocci. But when it ages, the bacteria changes. The bacteria become filamentous. In aged plaque, we contain filamentous bacteria and veillonella. So in young plaque, we contain cocci, but in aged plaque, we contain filamentous bacteria and veillonella. There's an other term which is used when we discuss about caries. It is Stephen's curve, which is most commonly asked question. Now, what is an Stephen's curve? When you have sugar, when you eat sugar, after 2 to 3 minutes, the pH decreases. As we already discussed, because this sugar will be fermented, resulting in acids, and acids will obviously decrease the pH. So when we take sugar after 2 to 3 minutes, the pH decreases from 6.8 to 5. After minimum of 40 minutes, our pH come to its normal value. So what Stephen's curve suggests? Stephen's curve says this is time and this is frequency of you eating food. For example, you have taken the sugar. So after some times your pH decreases. But after 40 minutes your pH come to the normal. What if you keep eating sugar? If you keep eating sugar, the pH will decrease, again it will increase. If you give less than 40 minutes of time and again you are eating sugar, your pH will again decrease. Again you give less than 40 minutes time and you eat. If you keep continuing eating sugar in more frequency, caries will develop because you are not giving pH its proper time to come back to normal. You are continuously eating sugar and starch, carbohydrate, whatever diet. So you are not giving the pH to come its normal range. This will result in development of caries. When we eat sugar, plaque occur. And when does plaque occur? If it does not brush. If we when we eat sugar, we do not maintain our oral hygiene, plaque occur. Still, if we do not maintain our oral hygiene, there will be some white spots start being visible on our tooth. These white spots are the pre-cavitated lesion. Pre-cavitated lesion means that your cavity is starting to form. Still, if you not take care, it will otherwise convert into a breakdown of enamel. So you have eaten a sugar diet, you have not maintained your oral hygiene, plaque occur. Still, you are not maintaining your oral hygiene. This will result in a white spot, which is the first stage of dental cavity caries to become visible. That's why it is called pre-cavitation. So, still you are not maintaining your oral hygiene, the surface layer of enamel will break. The surface layer will start breaking. Now what occurs if the surface layer break? It will result in formation of cavity. It will result in formation of a cavity. What does cavity means? That the protein matrix of enamel and dentine are removed by proteolytic enzyme. You have eaten a sugar diet, you does not maintain your oral hygiene, it will result in the white spot. When the caries are in the stage of white spot, you can remineralize them, because there are still chances that you can again gain the minerals and start remineralization of your cavity. But once the surface layer have been broken and the cavity is formed, the enamel matrix of enamel and dentine is lost, there are no chances of remineralization. You have to restore the tooth. You have to restore the tooth. Remember one thing, that the surface layer breakdown of enamel, the critical pH of enamel is 5.5, at which the enamel breakdown occurs. And from enamel to dentine, the caries spread in minimum for 2 to 4 years. Otherwise, it depends on a patient how much sugary diet it eat. And in remineralization, the tissue plaque present on the tooth, if it is for less time, the plaque present on the tooth is for less time, then remineralization will occur. So this was all about development of caries. Thank you for watching.